Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. March is Brain Injury Awareness Month, and today we're talking about traumatic brain injury, or TBI. According to the Centers for Disease Control and Prevention, about 2.5 million people sustain a traumatic brain injury annually. And TBI is the leading cause of death and disability in children and adults ages 1 to 44. What exactly is TBI? How is it treated? How do you prevent TBI? We'll get the answers to those questions and more as we're talking with Dr. David Adelson, neurosurgeon at the WVU Rockefeller Neuroscience Institute and WVU Medicine Children's. Welcome, Dr. Adelson, to Tuesday Talks.
Well, thank you for having me. I'm happy to be here.
Well, it's great to have you. So let's just start with the easy stuff right from the beginning. What exactly is traumatic brain injury?
Traumatic brain injury occurs when there's an impact to the head, which then, for lack of a better word, shakes up the brain and causes an injury.
Is traumatic brain injury different from a concussion, or is a concussion a type of traumatic brain injury?
Yes, exactly. A concussion is a type of brain injury. It's been in the past considered a mild traumatic brain injury, and that's in contrast to things more like moderate or a severe traumatic brain injury, or TBI, as you've pointed out. Concussion and a mild traumatic brain injury are both brain injuries, and they are the same in sort of the popular vernacular. Unfortunately, when someone hears, oh, it's only a mild traumatic brain injury, it's kind of like, oh, a mild sprain or a mild, whatever. It's really actually possibly very devastating, and that's what our concern is, and part of the reason to come here and educate your audience about what exactly is brain injury and what the issues are.
Yeah, well, I think like mild traumatic anything, it sounds like an oxymoron,
You're absolutely right, it is.
So what are the most common causes of TBI?
Well, again, it depends on age. We don't see too many 6-month-olds playing tackle football, but we do see plenty of teenagers.
Right.
And so, again, collision or contact sports are the most common as when we think about recreational injuries. We think of bicycle and others in young children. And then, unfortunately, we see brain injuries even in infants and toddlers, either from falls or from, unfortunately, things like non-accidental trauma.
Abuse.
Abuse, yes.
Yeah. What are the typical symptoms of TBI?
Well, when you have a traumatic brain injury, so when the brain gets shook up or impacted, there's a significant storm of electrical activity and chemicals. And so a lot of the symptoms that one has after the traumatic brain injury is trying to clear away kind of the bad chemicals or bad response that occurred from that trauma. The secondary effects are things like inflammation. So we hear about inflammation in a lot of diseases and disorders. And so very similarly, sometimes you sprain your ankle, you don't really feel it right at the time. You may have felt that shock of pain, but then it feels a little bit better and, it's not such a big deal and you go running around and play on it and everything else. The next day, though, it's very, very painful, and that's because of inflammation and swelling. Those are the kinds of things that are also occurring in the brain. So we can get symptoms of headache. We get symptoms of sometimes queasiness, nausea, vomiting. And the reason for that is that there's elevated pressure and there's irritation of the brain. And so those are the reasons we see those type of symptoms. Similarly, we also see things like cloudy thinking, inability to concentrate, difficulty focusing, difficulty making decisions, issues with remembering things. So you try to test a child after a concussion or an injury, and they'll have difficulty on recall, those kinds of things. Or in things that they've read, they can't seem to retain. And so that can be very frustrating and very difficult for them.
Well, when you were talking about the sprained ankle and the swelling, is brain swelling always a part of TBI? I mean, because there's no place to go for it to go, right?
You're absolutely correct. There's some element of swelling. It's not like to the extent like your ankle blows up.
Yeah.
That would be a more moderate or severe brain injury, and
Right.
and that does occur. We do see that, unfortunately, very frequently. And as well, there can be very minor injuries that in some people will cascade into a more severe type traumatic brain injury. So we do have to be careful, and we do have to be cognizant of these symptoms, that if they're not getting better or they're getting worse, that is a good time to go out and seek further treatment or further advice. And so go see a doctor or go to the emergency room, depending on the severity of that.
Don't put it off.
Do not put it off. If things are getting bad, getting worse, do not put it off.
I imagine early intervention plays a role in the amount of disability you could have from a traumatic brain injury.
Well, in a lot of different ways. In the more severe injuries, yes. I mean, we need to get those people emergently to a unit that can take care of a severe traumatic brain injury, or even a moderate injury. Those can also be associated with fairly bad swelling, with bruises in the brain that can further bleeding and cause major difficulties. When it comes to these, what we call concussive injuries or mild traumatic brain injuries, those are a little bit more complex. We don't have a lot of treatments for those. Most of it is the initial not getting hit again. That's an important one.
Yeah.
And that's a huge one. The second impact syndrome is a well-established syndrome where one gets a concussion, the brain hasn't recovered sufficiently, they go back and get another concussion or collision, and it can be quite devastating. It's almost really magnified in such a way that they can devolve to a severe injury very quickly, and a lot of individuals have died or suffered really permanent problems because of that. So,
It's scary when you think of it, because until recent years, especially playing sports, it was like, oh, you just got your bell rung, right?
Yeah. That's right.
And it was much more serious than that a lot of times, I imagine.
It was.
Yeah.
It was absolutely much more serious. And what would end up happening would be is they would get back to themselves. They'd feel fine. They would say, oh, I'm ready to go. And that could be in the same game, or it could even be the week later. But the reality is that the brain hasn't really completely recovered. And that's really now why you see these post-traumatic brain injury kind of concussive testing that's done, because we want to see them get at least back to baseline. Now, we're not saying you can't do anything. So it turns out that mild exercise, mild activity, plenty of sleep, all of those different things are reparative to the brain. So we used to say, no, you go into a dark room and then you stay there for days. No, we don't do that anymore. Now we encourage, like walking. We're not talking like go back and do drills.
No.
But we're talking about walking or swimming, non-impactful, non-contact, non-jarring type of activities. But even those, if those cause symptoms or problems, then we ratchet it back even more. Sleep is actually a great reparative mechanism, so we do encourage, quality sleep.
So that's a myth. I mean, it used to be like, if you thought, they said, they said if you thought you had a concussion, don't go to sleep, don't sleep, wait till we get to the ER,
Well, what they were saying really is they were being woken up every 2 hours in order to make sure that they weren't deteriorating, and should we go to the emergency room.
Okay.
Now, we do do that in some instances, but that would be very, very rare.
Okay.
That would be one mostly if you need to wake them up every 2 hours, then you really need to be in a hospital setting where they could be observed and woken up every 2 hours.
Yeah.
Those are part of the situation. But really, when we think about trying to let the brain recover, sleep is actually one of the best things for helping to clear the chemistry and
Wow.
gain back balance. Some people who are susceptible with regards to migraines, they'll get very difficult, what we call post-traumatic migraines and headaches. And so that can be miserable. They want a dark room. We don't want to usually cut off all stimuli because little bits of stimuli are actually good for recovery. When we, in this day and age, we try to reduce screen time.
Good luck with
and
that.
that's very difficult. Yeah, phone or TV screen or gaming consoles. Those are difficult. We usually now say not 0 unless it's causing symptoms. So what we would say would be short spurts. So do it for 15 minutes, then take a 30-minute rest.
Okay.
No problems with that a couple of times. Okay, move it up to 30 minutes with then an hour of rest in between. Now that can be difficult because a lot of times schools are now using electronic media as part of the teaching materials, right? And so, you know, we do have many times are giving letters and communicating with the schools such that they can be given allowances for greater time to try to complete certain work, especially if it's electronic.
Are those fairly recent changes in that approach?
Those are over the last few years.
Okay. I had a son who had a concussion 10 years ago, and they were telling him, you know, nothing.
Really, the recommendations have been evolving over the last, at least 10 to 15 years. But that's why we do these shows, right?
That's right.
To try to
That's right. We're here to educate.
Exactly.
So what are the main treatments for traumatic brain injury? I know you've touched on some of them here, but...
Well, it depends on the severity.
Okay.
So, clearly a severe traumatic brain injury, we're doing a number of things in order to try to alleviate brain swelling, to alleviate if there's bleeding in the brain, things along those lines. For more mild injuries, we don't have a lot of treatments. We do believe that it's due to an inflammatory response. So, again, we used to say, no, medications, but now if there's no bruising in the brain or blood that we can see, that for post-traumatic migraines, a lot of first-line medications can be helpful. Things like ibuprofen or naproxen or things along those lines that are anti-inflammatory. Unfortunately, sometimes that can prolong the symptoms because the symptoms that you're having is the body's response to try to rebalance things. And if you slow that down, then unfortunately you can prolong the symptoms and the problems. And so it's a little bit of a balancing act where you may not feel really good now, but if you can tolerate it, we rather push through it than try to give medications that may slow things down. So there's a lot of work that's still being done in this area, and we have a lot more research and science that we have to do to figure that part out. So I would say it's too early to tell. But there is cognitive treatments for those that are having difficulties with memory or retention or focus. There's also treatments for many times people feel very dizzy and that they can't seem to focus their eyes and things like that. Well, there are some balance work that can be done, and physical and occupational therapists can work with that, who are specially trained. And so those are really kind of the things that we see. So some medications for the headache, maybe for some of the nausea and queasy feelings, therapy for balance and and different therapy for cognition and thinking and memory.
Yeah, yeah. So how is TBI diagnosed? I mean, are there particular tests, or does it depend on the level, or?
Yeah, well, number one, you have a history, so you know that the head got hit.
Yeah.
Really, part of the issue is, how severe was that mechanism of injury, so what we call the primary mechanism. So if somebody was in a motor vehicle, were they belted, or did they, hit the dashboard or the seat in front of them, or things along those lines. If they were on a bike, were they found unconscious, or are they able to remember what happened? So part of it is in that initial exam, it's understanding what happened, how did that trauma occur, so what is that primary mechanism and impact? The ability to remember, either going backward or forward, which we call retrograde or anterograde memory. So if they could tell you, yeah, I was riding home on my bike and this blue car hit me, and then and now I remember it all. That is a lot milder than not even remember getting on the bike, or not even remember how they got home, or any of those kinds of things. So those are the initial clues that they've had an injury, and the ability to kind of tease those things out from if they've had a more milder injury, not a mild injury, because any brain injury is a serious injury.
Oh, yeah.
But if they've had a more milder brain injury versus a more severe, where they are unconscious, they're not able to respond, those kinds of things. And then, once they're seen by the emergency services group, so paramedics or EMTs, they can, the importance there is maintaining their oxygenation and their breathing and all of those different things until they can be evaluated in, let's say, an emergency room, where they might get imaging to determine the extent of the trauma that has occurred to the brain, if there's bleeding or bruising, if there's areas of indication of stroke, fractures, those kinds of things. Those are what's being looked at when we're doing the imaging to do the diagnosis. If someone's had let's say, a clear imaging picture, well, then the testing that we are often getting into in the more mild injuries are things like balance and cognition and memory.
Okay.
And so let's just say they had this injury, they're feeling okay, a little bit of a headache, they can talk, and everything seems fine, but they went back to school and they can't seem to focus,
Concentrate.
or
Yeah.
they can't see straight, or they get a severe headache by around 11 or 12 in the day, and they can't get through the whole day, and so those are times where we see what's called a post-concussive syndrome, and then we would do further testing on them in order to see, are they having indeed those issues like focus, memory, cognition,
And
things
maybe
like
it's
that.
more serious than originally thought.
Exactly. They may look normal, they talk normal, but they're not able to function.
Yeah.
I mean, I've seen, unfortunately, kids and adults who had this quote-unquote mild traumatic brain injury, just a concussion, just had their bell rung, and they weren't really able to go back to normal school. They weren't able to go back to their jobs, those kinds of things. And so, and again, it's not to put out there in the audience, this big scare, but rather just to make people aware.
I was just going to say awareness.
Awareness is key. It's hopefully if it's mild enough and you've been wearing that helmet when you're biking, and you were wearing the seatbelt, and the airbags deployed, and everything was good, you still may have a more milder injury. But to recognize that if things aren't right, then that's a time to go seek out further help.
Yeah. Well, let's talk a little bit about pediatric TBI. I mean, is it that much different from adult TBI?
Well,
because they're
us
still
in the
developing.
pediatric world.
Yeah, because I'm thinking it would be much more serious because their brain's still developing. Because
Correct.
aren't our brains still developing till we're like 25?
Well, it's
Or is that an overestimate?
No. Well, I mean, the things to think about is that it is still developing and still what we call maturing. And there are some factors where younger people will do better than older people. And that's very true. But our brains are never stop developing, because otherwise
Sure.
you wouldn't remember that I was here if I walked out the door. You wouldn't be able to, get better at, a hobby or an activity or a language or things along those lines. So the brain is still plastic even as we age,
Yeah.
but it has less resiliency and less capability as we age. But having said that, very young children actually have worse outcomes than slightly older children. So infants and
yeah.
toddlers don't do as well as, let's say, school-age children.
Okay.
Now, with regards to the differences, is exactly right. While a child may be very plastic, as I mentioned, may
Yeah.
be a situation where they have better connectivity and better recovery, if they've not reached certain levels of maturity, they may not be able to go beyond that. And
Oh,
that's
wow.
the problem, because the brain hasn't developed the sufficient foundation for it to learn, let's say, certain activities.
Yeah.
And so if, for example, we interfere with a child before they've learned language, then they will have a very difficult time learning language. But similarly, if we deal with an adult, if they lose language, their likelihood of getting that back is less likely than in a younger child.
So it sounds like the very young and I don't want to
older.
say the very old, but the older.
The most mature.
Yes,
Let's
that's
go
a
with
good
that.
way to put it. That's a good way to put it.
Sure.
That's your specialty. Do you treat TBI in children differently than you would treat adults?
In some ways, because they have that ability to recover, and they are more plastic, and oftentimes they want to play, they want to do activities, they want to go out with their friends. We can be a little bit more aggressive in trying to treat that, but recognizing that if it's too much, we need to scale it back. So there are some differences in dealing with children and adults, at least with regards to the milder injuries. On the more severe side, unfortunately, we know a lot more about adult traumatic brain injury than we do about children, and that's despite the fact that, as you pointed out in the intro, is that traumatic brain injury still remains the leading cause of death and disability in children. And yet, we know more about cancer, and we know about brain tumors and leukemia than we know about traumatic brain injury. And I would argue the brain is the most complex organ we have, and yet we don't have a lot of information, literature, science yet when it comes to what's the best ways to treat that. I think it's coming. It's a lot better than when I started my career, but not by a lot. I mean, some of the same concepts that we were treating patients back when I was a resident still hold true today, but we haven't progressed super far because we haven't been able to find really optimal treatments that we can implement. So I think we're more aware of what happens after the injury and how we might intervene. But when we look at the width and breadth of the literature, it hasn't translated yet into the clinical setting.
Well, what are the common causes of TBI in children, and what are the ways that we can prevent that? Because, a lot of these children are so young, they don't have any control on anything, so they're relying on us. So
Sure.
what are the most common causes, and what can we do to prevent that?
Well, I think it's important, really. We don't want our children to live in a bubble, and we don't want to put them in bubble wrap and in a padded room. That's not how children grow and develop. We want them to play. We want them to participate in activities. We want them to do sports. So with regards to mitigating or lessening the possible injuries that can occur just with natural life, the first thing is preventing it and, or mitigating that injury. So again, using just bicycling as an example, it's wearing a bike helmet. A bike helmet saved my life. I can, absolutely say for certain that, I suffered a significant injury on a bike, and, I suffered a mild traumatic brain injury, which would have been a lot more severe if I wasn't wearing the helmet. Wearing seat belts, those kinds of things are important for us to prevent those injuries. And when it comes to sports, learning the appropriate techniques for, let's say, tackling, or for, on equipment, let's say gymnastics, or in cheerleading, and, making sure that there are safeties, and you ensure that someone doesn't take a horrible fall, that they're being spotted, that they're indeed being able to do the things that allow them to push the limits, but do it as safely as possible. Not stopping them, but just as safely as possible.
But I mean, even like in football, no amount of padding on the outside of your head is going to keep your brain from bouncing off the inside of your skull. So
true.
Technique is important.
So technique is important. The rules are important. Clearly, helmet-to-helmet contact has been outlawed, and quote unquote, but it still occurs.
They're trying to enforce it.
Yeah, I mean, when you're playing for millions of dollars, I can see where the passion can kind of get in its way. On the other hand, we really don't need 13 and 14-year-olds spearing each other. I mean, they should be learning, good technique, and the rules should be enforced stringently so that they learn appropriately how to do it. And I think. My opinion, of course, but I think that, there are a lot of things we can do where athletes, children, adults, anybody can enjoy life and do it as safely as possible. Because if we can lessen that impact, that primary mechanism, we can then lessen the cascade of events that occur, the inflammation, all of the other things, and then the next most important point of how to really improve recovery is to really optimize our rehabilitation in those instances. So.
Yeah. Do most people fully recover from TBI?
Well, the vast majority recover, but anytime you suffer an event of any kind, even an event, us talking, for example, it's not traumatic, but yet it has an imprint on the brain. Right?
Yeah.
It is, I will have remembered coming here and how to get here and where to come and things like that. That was what we would consider a positive imprint on the brain.
Yes, we like
versus,
those.
Versus a trauma. And there are people who suffer traumatic brain injury and seem to recover fine, but, we do know of people who've had PTSD, and that's even just being in a traumatic event, even though they may not have suffered a traumatic brain injury, that in and of itself is imprinted on the brain and has caused now a response, so they want to avoid a similar situation in the future. So I would say that everybody is affected by traumatic brain injury. If you've had an injury, it's what you do with the result of that and whether you can turn it into a positive or not.
Yeah.
And that's also why we feel very strongly, and I would say within the medical community, why, being able to have, one concussion or a second concussion, it used to be, kind of 2 and out, and that's why people were afraid to report it. I don't think we're as stringent about that as much if their testing is good. And so let's say somebody, has baseline testing and passes that testing, and they've had a certain amount of rest period and non-collision and move back into activities in a natural and normal way, then they're more likely than not going to be able to go back to that activity. But the problem is that once you've had a concussion or a mild injury or even a severe injury, you're much more likely to suffer a second and then a third and then a fourth injury with even less and less and less
Yeah.
force. And so unfortunately, we do get to a point where, maybe that's not the best sport for you to play.
Yeah.
And, maybe we need to look at a different situation for you to enjoy your life, to have that energy, to be able to do the things you would like to do. We're not able to do all those. I used to play rugby, and
Oh, wow.
a couple of concussions later,
I bet. Yeah, I'm not surprised.
if I really wanted to do medicine, I needed to kind of keep my brain somewhat intact.
Yeah.
Especially neurosurgery.
Yeah, yeah.
So.
Well, speaking of neurosurgery, can you talk a little bit about the level of expertise that we have here at the Rockefeller Neuroscience Institute and WVU Medicine Children's? I mean, here in Morgantown, West Virginia. I mean, I don't think people realize the level of expertise we have right in our front yard.
Yeah. It was one of the things that drew me here. It was very exciting to come to a place that really is at the cutting edge when it comes to really being able to look at comprehensively children and adults, with different diseases and disorders. And so, with regards to traumatic brain injury, it'll never be perfect. We're on the build, but we've recruited really some of the best and the brightest, and it's really what's an honor to be here. And the administration and the university and the health system has really been behind how do we elevate the level of care that we give, and that is here in Morgantown, but our goal is to be able to spread this knowledge across all of WVU medicine, to really be able to ensure that the diagnosis and care can be done locally if necessary, as well as if they needed more advanced levels of care or advanced levels of treatment, that they have a place to come to. And that's really what we hope to achieve here in Morgantown, and but also how we hope to achieve things throughout the state and through the health system.
Yeah. So before we go, can you tell me what's the most important thing you want our viewers to know about traumatic brain injury?
Yes, well, the most important thing is that a traumatic brain injury is never just a mild thing.
Okay.
So
Okay.
any brain injury is a serious issue. And while I'll be absolutely tickled and happy as a clam that somebody can bounce back very quickly and go back to their usual activities and all of that, we do want people to take it seriously. We do know that even what seems like a very, very mild injury, if you're having symptoms or if it's worsening, it is not a minimal problem. It could be a major problem. And so my one takeaway is that no brain injury should be minimized, especially if there are symptoms or signs or an indication that there's more than there's to the outside.
All right, good to know. Thank you so much for sharing all this important information with us.
Wonderful to be here. Thank you.
Well, thank you. And that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about traumatic brain injury services, visit rni.wvumedicine.org/concussion. I'm Mary Ravazio Menard, and on behalf of Dr. Adelson and everyone at WVU Medicine, thanks for joining us and have a great day.